I hope you all are enjoying the distinguished guest we have during the summit. And today we are going to be addressing moral injury, but this time we're looking at moral injury with the abortion pill, also referred to as RU 486. And our distinguished and expert guest today, we're so excited to have you, Dr. Donna Harrison. And you're an expert in your field. So you are a physician, you're board certified on obstetrics and gynecology. And just welcome and tell us a little bit about yourself.
Well, thanks so much for asking me here. I'm a board certified OB-GYN, and I'm the executive director of the American Association of Pro-Life OB-GYNs. It turns out actually that 85% of OB-GYNs do not do abortions. But our professional organization that's most known is the American College of OB-GYN, and they have become radically pro-abortion. So they've alienated a lot of their membership, and that's why our membership is growing. So we practice according to the Hippocratic Oath, which forbids both abortion and euthanasia, as having no part in our healing arts.
I remember the Hippocratic Oath. Go ahead, sorry.
Sorry. And we exist to make known the effects of abortion on women, as well as the effects of abortion on their unborn child. So we defend both the woman and her unborn child with medical science.
So instead of having a surgical procedure, surgical abortion procedure, many doctors are prescribing the RU486. And in your research, what physical complications have you found associated with the drug?
Well, thanks for asking, because that's a really important question that most women do not know because they don't get much informed consent before an abortion. The way the abortion drugs, and there's two of them together in a regimen, the way that abortion drugs work is the first drug is RU486, also called mifepristone, or Mifeprex is the trade name of the drug. And what that drug does is it acts like a false hormone. So there's a hormone that women have in their body called progesterone that their body makes when they're pregnant. And that hormone changes their body to allow their body to take care of the baby, to receive the baby into their womb and to nourish the baby during the pregnancy. Without that hormone, the woman's body can't receive the baby and will cut off nourishment to the baby. So mifepristone blocks progesterone. It blocks that natural pregnancy hormone. And it not only blocks it in the woman's womb, it blocks it in her brain, her breasts, her ovaries, all over her body. What are the effects of that? Nobody knows because nobody's looking. But in the womb, the progesterone, by cutting off the nourishment to the baby, it causes the baby to die, to starve. And about one, or maybe 5 or so out of 100 women will then pass the baby on their own after that. But if she doesn't pass the baby in 2 days, then she's to take a second drug called misoprostol or Cytotec. What the misoprostol does is it causes the uterus to contract. And so if the baby's died or is in the process of dying, then the contractions caused by the misoprostol will cause the woman to squeeze out the baby. And that's part of what we're going to talk about, because this isn't like a surgical abortion where you go in, you're given some anesthetic, and you see nothing. In these cases, the women oftentimes can see the baby's body, and it's a recognizable baby's body by the time you get to 8 weeks.
8 weeks. So what are some of the physical complications that you've seen then from that?
Great, thank you. So the physical complications that you see with the Mifeprex misoprostol abortion are what you would expect. They're massive hemorrhaging. So we've reviewed adverse events. We've reviewed complication reports that have shown women needing 10 units of blood. just massive, losing over half their blood volume and nearly dying. So this is a significant complication. And we also see tissue left inside because not all of the tissue is always squeezed out when the misoprostol is given. So sometimes there's tissue left inside and that leads to infection. That leads to severe infection. In fact, we know of about probably now about 13 or 14 women who have died from a severe overwhelming infection because of the misoprostol and the mifepristone. Why is that important? Well, both mifeprex and misoprostol, both of them suppress a woman's immune system. And we know that from animal studies because if you take animals and you put bacteria in their bloodstream, usually about 20-30% of the animals will die and the rest will recover. But if you put mifeprex, the RU46, in their bloodstream first and then you put the bacteria in the bloodstream, 100% die. And it's similar with misoprostol. The drug that's being given either through the vagina or in the mouth, in the cheek, also causes a profound suppression of a woman's immune system. In fact, it was because of the animal studies done in part, let me start over again. So the animal studies were done using misoprostol, the second drug, in the vagina of rats. And those studies showed that the rats were much more susceptible to lethal, fatal infections. In part because of the susceptibility to fatal infections, Planned Parenthood changed the way they gave misoprostol. So they gave it in the cheek now instead of in the vagina. But it turns out that the misoprostol level in a woman's body is the same, whether you give it in the cheek or in the vagina. And also women have died from overwhelming sepsis, overwhelming infection when misoprostol is used in the cheek. So it has to do with the misoprostol suppressing a woman's immune system and making it more difficult for her to fight off normal bacteria. The combination of both of them can be lethal for women.
So is there a research article that, people that want to know more about this, is there an article that we could go to specifically, or?
To answer that question, let me talk about the approval process a little bit for RU46. RU46, mifeprex, was rushed through the FDA under a special authorization that the FDA had to approve drugs that were to treat life-threatening conditions. So things like overwhelming infection or life-threatening conditions. Well, pregnancy is not a disease. And mifeprex, the mifeprex, the abortion regimen, doesn't treat any disease. But under pressure from a political administration, mifeprex was rushed through the approval process. And the one thing that the FDA did was to approve it under something called Subpart H. Subpart H was the way that the FDA had of putting some kind of restrictions on a drug after approval. Because the only power that the FDA has is to approve or not approve a drug. And once a drug's on the market, then doctors can use it any way the doctors want. The only thing that limits the way a doctor uses a drug is fear of malpractice. So
What? I'm sorry?
Fear of malpractice is tort law. That's the only thing that limits a doctor. And the abortionists knew this, and they planned from the moment of approval to completely ignore everything that the FDA required. But one of the things the FDA required was that the manufacturer submit reports of bad things that happen to women, like death, like life-threatening infection, like hemorrhaging, like needing surgery. So that is one thing that Danco did submit to the FDA. However, most abortionists, and this is what we found out during the analysis of the adverse events, most abortionists don't know what the complications are. after they take the abortion drug, because most abortionists don't handle their own complications. They send them to the emergency room. And that's really clear if you look at studies done by the abortion industry. The studies done by the abortion industry, and I can make that information available to you later to anyone who's interested. The studies done by the abortion industry show a very low rate of complications after mifeprex abortion. But those are only the complications that the abortionists know about. The complications that the abortionists don't know about are the ones that show up in the ER and the woman lies and says, I'm having a miscarriage. Or she tells them she's having an abortion but doesn't give the name of the abortionist or doesn't give permission to release the records. In those cases, the abortionists never know that she had a complication. So that's why the Niinimäki study, the study that from Finland, is so important. The Niinimäki study looked at 40,000 abortion patients, about half surgical, about half chemical, with mifeprex and misoprostol. The surgical abortion patients did much better than the chemical abortion patients. So the chemical abortion patients had 4 times the, excuse me, little drink. The chemical abortion patients had 4 times the rate of complications of the surgical abortion patients. They had tissue left inside that required emergency surgery. They had hemorrhage. They had infections. And these are the kinds of things that, that make chemical abortion so difficult for women, because the abortion industry wants women to believe that you just pop a pill and poof, it's over. That's what they'll tell women. That's how they sell the drug. But the reality is these women have to labor. They have to deliver the baby. And like you mentioned before, a lot of times they see this. And this is not something that most women feel prepared for. In fact, I think we talked already, Kay, about the website Abortion Changes You. There women are telling in their own words their experience with the chemical abortion. Their experience with the chemical abortion. So yes. What we know from the Niinimäki study, from the Finland study, is that women are experiencing a lot of complications. And some of these complications are life-threatening complications, which is what we found when we published our study in 2006 of the reports that Danco had submitted to the FDA. We obtained them by a Freedom of Information Act. And what we found was that Danco is submitting horribly deficient reports. But in addition to that, there are women who are losing half their blood volume. There are women who have retained tissue inside, and the abortionist doesn't know how to handle it. There are a lot of women presenting PR. And this is a problem that women are not being told about. They're not being told about the dangers of the drug. They're not being told about the process. It's a real informed consent issue, as well as a real threat to women's lives.
And who is Danco?
Oh, so when, it's a very interesting story. Some investigative journalists should pick this one up. When RU46 was developed in France, the company, when RU46 was developed in France, the company who developed it, Roussel Uclof, which is where we get RU from in the RU46, Roussel Uclof said they're not going to market it in the United States because they were afraid of lawsuits because there's so many complications. Clinton, at the time, instructed RU46 that they will, or instructed Roussel Uclof that they will indeed market it in the United States. They said they're not going to do that. So Clinton helped to broker a deal between Roussel Uclof and Planned Parenthood. So Planned Parenthood at that time had a subsidiary called the Population Council. Planned Parenthood and the Population Council go way back into their eugenic roots of getting rid of human weeds. And they're super racist. So, but we won't go into that subject right now. Anyway, Roussel Uclof gave, without any cost, the right to manufacture and distribute RU46 in the United States to the Population Council / Planned Parenthood. Well, the Population Council / Planned Parenthood, they don't manufacture drugs, nor do they distribute them. So they created a shell company called Danco. And Danco is a company that has assets in the Cayman Islands, so you can't possibly sue them. They have no deep pocket. And Danco is the one who is the shell company that has the right to manufacture and distribute in the United States. Well, Danco doesn't manufacture and distribute either because it isn't a real company, so they contracted with Hualing Pharmaceuticals in China. And at that time, Hualing Pharmaceuticals was under censure by the FDA for terrible manufacturing processes. So that's how we get our drugs from China. Now, as far as I know, the Hualing Pharmaceuticals is still supplying Danco with RU46, unless they have another supplier that is way under the radar, which is possible. But that's the story. That's who Danco is.
I had not ever heard of that. So, and I had listened to one of the documentaries that you had done, and you had concerns over the RU486 going worldwide, and we know that medical abortions are not, that's the intent, is to make RU486 worldwide for women. So tell us, what are your concerns about that? And they are valid, but tell our viewers.
Okay, so when we're analyzing the adverse event reports that were sent to the FDA, what we found is that there were many women who hemorrhaged nearly to the point of death, but they made it because they had access to an emergency room. When you use RU46 in a situation where you can't access emergency services, then you turn a serious complication or a life-threatening complication into a death. And right now, no one is tracking those deaths. There are very good statistics on women who die after childbirth because that death usually takes place in a hospital with records. But women who die after an abortion, no one's tracking. And no one wants to track it. At least those who track deaths, let me say that a different way. But if you die after an abortion, there's no mechanism for capturing the death. In fact, if you look at medical systems, the way we record things in medicine, we do it by coding, okay? By a certain number means a certain thing. So
Right.
When we make a diagnosis, we put that in. Okay. When you try to code an abortion death, there's no code for it. There's codes for what the thing that she died of, like hemorrhage or tissue left inside, but you can't connect that to a chemical abortion. So it's a very subtle way of closing your eyes and not seeing what's happening around you. And women are dying from this. And what we know about is just the tip of the iceberg of the women who are actually being harmed by this drug.
And thank you for that. What we're doing is, we're looking at the, biological, psychological, social, and spiritual part of abortion. So, that's, that physical part is so important. But let's go to the emotional and psychological and even spiritual effects from this abortion. Now, you had said that, and I know because I do, crisis counseling calls. And you said that they're really not prepared. They're at home and and they thought they were going to pass maybe a blob or a mass of tissue. But that you said in 8 weeks they see a fully formed baby. Is that right? Even at 6 weeks, you can see, right? I mean, even in that little embryonic sac, right?
You can see at 6 weeks, but it's not as clear as when you get to 7, 8 weeks. At
Okay.
7, 8 weeks, you can really make out a head and arms and legs. So, and as you get further and further, I mean, by 10 weeks, the whole body is fully formed. You can completely recognize it down to fingers and toes. So um, that's part of the problem. Here she is. She's been set up with an expectation. She's been told, "Oh, this is natural. It'll be like a period, um, and then it'll all be over with." Sorry, I've got allergies, and so the allergies are just terrible right now. Um, so she's been set up to think that this is just going to be like a period. She's going to go home and have some cramping, and then it's all over. Well, that's not the reality. The procedure is very, very painful. And then when she does pass the tissue, it's not just tissue. It's actually a person, a recognizable human body. And women are not prepared for that. They're not being told that they're going to see their baby. And that's got to be traumatic. And what's
Well, it
even
is.
more
I mean,
what's
it's
even
very,
more
go ahead.
no, go ahead.
Well, I mean, I witnessed trauma, over the phone. Like I'll never forget my first call that I ever had with this was a gal that she was in trauma and she had just passed it. And when she called, she was hysterical and she said, "It's in my hand, it's in my hand, it's in my hand. What did I do?" And, you know, they're really not instructed, and so many times they're flushed down the toilet. And, I couldn't say flush it down the toilet. That just seemed, that seems inhumane, when she's seeing this. It's like when we're talking about the moral injury piece, that's
Right.
where the trauma comes in, because it's not that blob like what you were hoping for, but you're seeing the baby, and then that's where the trauma comes in. And Dr. Harrison, I had an abortion when I was 17, and so thank you. It was, the procedure was traumatic for me, and I went into that. You're told, the women with RU486, it'll just be over. You can go home and never have to think about it. But the reality was, when I saw the ultrasound of my next pregnancy, I saw a fully formed baby. And what was so traumatic for me was that next pregnancy, the pregnancy that I had aborted, that baby was 2 weeks older than what I was seeing presently on the screen. And that's when my nightmares started, and anyway, my trauma. So I see how traumatic this can be. And there was another instance just a couple weeks ago where I had a call, and this situation was, the father of the baby was with her, which a lot of women don't have that, but the father of the baby was going to help her and to get through this. And when she passed it, he yelled out, "Don't look, don't look, don't look." And that made her look. And so both of them, I don't know if they're experiencing trauma, but she was calling me on that crisis hotline saying, I have this memory that I can't get rid of, and I'm not doing well with this.
Oh, yeah. And you can see, I mean, you know what the experience was like, just knowing the next time when you saw your baby on the ultrasound, and knowing that that the baby that you lost was even further along, that trauma. And then add to that the reality of you're seeing the baby that you lost. It's got to be a really difficult, it's got to be a horribly difficult situation. And compounding that, Kay, I think is the idea that you took the pill. It's this self-condemnation that comes because you become the agent of the abortion. And what my heart just goes out to these women, because oftentimes they are not the agent. What they're pressured, They're coerced. In fact, if you want to read something that'll break your heart, I don't know if the Guttmacher website still has it up, but they used to have a couple studies when you Googled reasons women abort. If you read that, it'll just break your heart. I was alone. I didn't have enough money. My parents told me I had to. And one woman captured it just in what she said. She said, I could have made any choice as long as I chose to abort, which means she had no choice at all. So you've got this huge amount of coercion going on. And the chemical abortion availability now, and they're trying to make it available over the counter almost. The chemical abortion availability means that men who are abusers can get it. Pimps can get it. In fact, there was one website that was selling RU46 online that gave a bulk discount. Now, who in the world needs a bulk discount for RU46 except pimps and abusers? Okay, so it's gone crazy.
Now, wait a minute. I gotta stop you for a second, because how are pimps being able to get it? Help us understand that, because yeah.
Okay. I need to send you a video that was on TikTok of a guy who ordered RU46 online and got it sent to him. And it's a wonderful video. He's a pro-life guy, and he said, I won't steal his thunder, but I'm going to send you the video. Anyway, there were, as of, I believe it was last year, there were about 80 plus websites where you could go online and order RU46. No doctor's appointment, no prescription, like women on the web. As an example, the website that FDA shut down, Women on the Web, there was a doctor from Europe who was sending through the mail RU46 to women who ordered it online. And that doctor had never examined the patient, had never seen them, doesn't know anything about them, doesn't screen them. There was no prescription. Nobody even knew how far along they were. And so you have this availability, and there's at least 3 cases I know of where boyfriends who didn't want the baby have gotten a hold of RU46 and put it in their girlfriend's smoothie to cause her to abort. So this is the kind of thing that happens when you have a dangerous drug with no control. And right now, there's almost no control over how the mifeprex abortion regimen, RU46 and Cytotec, misoprostol, how they're being used. And that's part of the reason why the recent call to take RU46 off the market is actually quite important. Because in reality, what's happening is this dangerous drug is out there, and women are being given this drug sometimes without even their knowledge. And they're experiencing the hemorrhage, the emotional trauma, the grief. Who's taking care of them? Who cares? Who cares about them? We need, as a country, to care about the women who have children, and we need to care for them and provide for their needs so that they don't feel coerced into having an abortion.
Dr. Harrison, I have a question. So the RU486, you mentioned something about they don't know how far along they are. So is RU486, as I understand it, it's only like meant to be during a certain stage of pregnancy. Is that correct?
Well, that's correct. And let me talk a little bit about that. So when the FDA looked at the very, very minimal data from the United States, and they looked at the manufacturer data, and that's all they looked at to approve the drug, which in and of itself is not allowable under FDA rules. But when they looked at that, the FDA said the risks go up as you're further and further along in the pregnancy. So the risks at 7 weeks are less than the risks of hemorrhage, infection, retained tissue at 10 weeks, at 12 weeks. It just goes up. And there's several very good studies that show that. So when you look at women who abort at, let's say 8 weeks, you've got about 8% of them ending up in the emergency room afterward. And when you look at women who are 12, 13, 14 weeks, 1 out of 3 end up needing surgery. 1 out of 3. So the risk,
Wow.
as the gestational age, as the further along in pregnancy you are, the higher the risk. And women don't know that either. And when you look at studies of women who have who come in to OB-GYNs and they think they're a certain length along in their pregnancy, about half of them aren't. About half of them have different dates. And that's why we do an early ultrasound, so we know what a woman's dates are. But if you're not doing an ultrasound and women don't have regular periods, which a lot of teenagers don't have regular periods, a lot of women who are under stress don't have regular periods, women who have been taking the birth control pill and come off, won't have regular periods for a while. So without a regular period, you can't really know how far along you are. And so women who are in that really high risk range of 10, 12, 14 weeks, maybe taking this pill and having a 1 out of 3 chance of hemorrhage, 1 out of 3 chance of needing surgery. It's obscene. You'd never get away with this in any other area of medicine.
Well, and I think about, these women in, impoverished communities that don't have the ultrasound that might be giving this drug. They could be 6 months along, right? I mean, am I right?
Yes, you're right. They could be. And again, if you don't have regular periods, it's very, very difficult to know exactly how far along you are. And so without having someone examine you, without having someone do an ultrasound, you're putting yourself at great risk of serious complications and even death. Women have died from hemorrhage from this drug. They've died from ruptured ectopic pregnancies, which is another issue. Okay, so sometimes in this country, about 3%, 3 out of 100 women who are pregnant will have the baby plant in the tube instead of in the womb. When a baby plants in the tube, then that baby grows, but your tube is very, very small. It's like, your finger wasn't meant to hold a baby as it's growing. So what happens is the tube ruptures, and when the tube ruptures, you can lose almost your entire blood volume in a couple hours. So it's one of the serious ways. In fact, it's one of the most common ways that women in early pregnancy die. It's a ruptured ectopic pregnancy. But without doing an ultrasound, you have no way to tell where that baby's implanted. And when you talk about the hundreds of thousands of abortions, there's a lot of women who have ectopic pregnancies. This drug regimen, the RU46, doesn't treat an ectopic pregnancy. It doesn't stop it from growing, because the only place that the RU46 works is when the baby's implanted inside the womb. So these women have pain and they have cramping, and they call and say, hey, I've got pain and cramping. And the abortion clinic on the other end says, oh yeah, honey, that's normal. Honey, just stay at home, take your Tylenol. If you have a problem, go to the ER, i.e. it's ain't my problem, sweetheart. Y-O-Y-O. And so she's left trying to decide how much pain and cramping is enough for me to go to the ER. It's crazy. And she's in the middle of cramping. She's supposed to be her own doctor. It's just the situation that it puts women in is just really obscene.
And when you said that, I'm reminded so many times when, like I said, we answer crisis calls, and a lot of times we were asked, like, I'm bleeding, and they said it was only going to be such and such, and they start talking medically, and we have to say, we are not a medical facility. Please reach out, to your physician, your primary care physician. And, we suggest, if you're really, in serious trouble, to go to the emergency room. So we do get a lot of calls like that. So, go ahead.
The emergency room is the right place to send them. But real doctors take care of their patients. They don't start a procedure and then say, you're on your own, honey. If you have a problem, go to the ER. They are there for their patients. We have accountability. Like I said, you'd never get away with doing this kind of thing in any other medical situation except abortion.
Well, and there have been a few times that they say, well, you know, they gave me a number to call, but I can't, nobody's answering the phone. And so then they start researching, you know, out for numbers. So they're not being followed up with. So
Mm.
I want to ask you another thing. So there is a lot of differing opinions regarding the reversal pill. And I don't know what you call that technically, but you know, that when you take the first pill, that there is another pill that counteracts that might save the baby. Can you talk about that for a little bit?
Sure. That second pill that you take, okay, so you take the Mifeprex, and the Mifeprex works by blocking progesterone. But it turns out that if you take progesterone, you can flood the Mifeprex off the system. You can wash it away. And they've actually known this from the very beginning of the development of Mifeprex. They did animal studies to show that if they gave animals Mifeprex and then they gave them progesterone, they didn't abort. And we've been
So it's
using
just a heavy
progesterone.
dose of progesterone.
It's a
It's
bigger dose of progesterone. But we've been
okay.
using progesterone for 60 years almost in medicine. We've used it for women who have trouble carrying babies because we know that the progesterone is what allows the woman to make the changes that supply the needs of the baby. So in medicine, progesterone is one of the safest drugs that there is. So we've used it. It's never caused birth defects. It's a very, very safe drug, and all the infertility docs use it. After in vitro fertilization, women are routinely put on progesterone. So what we're doing is we know that the woman has Mifeprex poisoning, so to speak, and we're giving the natural antidote, which is progesterone. You wash it away. It turns out that in studies that have looked at this, if you take the progesterone within 72 hours of the Mifeprex, that you can increase the chances of survival of the baby. It's not 100%, okay? So if a woman just takes Mifeprex and she doesn't do anything else, she's got about a 25% chance that the baby will survive that poisoning and go on to develop and live. But if she takes Mifeprex and progesterone, she's got a 70% chance, roughly 70% chance that the baby will survive. So it increases the chances of the baby's survival. Now, there was a very interesting study that was done by a notorious abortionist out of California. His name is Dr. Kreinen, and he designed a study to prove that abortion pill reversal didn't work. But he only got 10 patients, and the study was stopped for safety because some of these women were hemorrhaging, seriously hemorrhaging, going to the ER. One of them had to be transfused. Well, when you flesh out his numbers, what you find is that he's got half the patients in the Mifeprex only arm, the mifepristone, the RU46 only spot, and he's got half that have RU46 plus progesterone. In the ones who had RU46 plus progesterone, 4 out of 5 had living children at 2 weeks. And 1 out of 5 did have a heavy bleeding, went to the ER, but the bleeding stopped by the time she got to the ER. In the ones who had mifepristone only, you had 2 of them severely hemorrhaging, and 1 of them needed a transfusion. So the study was stopped, showing that Mifeprex alone is dangerous. But what's even worse is that the study author said, oh, well, it's because the women didn't take the second drug, misoprostol, and if they'd taken the second drug, they would have been fine. But in my review of the adverse events after Mifeprex and misoprostol, there was still a lot, and maybe even more hemorrhaging after the misoprostol than there was with just Mifeprex alone. So they can't say what they said, and yet the media picked up and ran with it and said, abortion pill reversal is dangerous, when that's not actually what the science showed. So pull the study and look at the numbers. It's just amazing. 4 out of 5 women had living children at 2 weeks. That's 80% survival. That's great. What he did was show the exact opposite of what he planned to show. But the truth is the truth.
And I've heard women say, I changed my mind, but they told me that no, it's too late. So that's a lot of misinformation that I've experienced just through these women's stories, when they're calling. And I just, I listen to their stories, and, it's heartbreaking. And it's frustrating because, just like what you're saying, I had not interviewed a doctor about the medications. So this is a lot of information that I'm taking in that's new. So I appreciate all this that you're sharing. So is there anything else that, we're coming to a close. Is there anything else you would like to share that you think our viewing audience should know?
I think that women need to know they're not alone. There are people, there are resources. If you're feeling pressured to have an abortion, if you have been pressured to have an abortion and you're going through that terrible regret, there are people that can help. There are resources that can help you through. And so you're not alone. And there's a lot of women who care very deeply to see you not hurt and to see you helped. I think that's probably the bottom line.
Yeah. And where can people go to get more information about you and your work? Is there a place that you can go?
Yes, we have a website. It's the American Association of Pro-Life OBGYNs. And we are doctors who practice Hippocratic medicine, which forbids both abortion and euthanasia. Our website is AAPLOG, so 2 A's, so aplog.org. But if you just Google Pro-Life OB-GYNs, you'll find us. And our website has wonderful resources. There's a tab at the top, and under the resource tab, you will find practice bulletins and committee opinions and just a lot of information about some of the more cutting edge topics of what's happening in terms of medicine. So we just invite you to come to the website and tell your doctor. My goodness, when OB-GYNs hear about us, they say, "Where have you been all of my life?" So it's important that you bring that information that you find on our website to your doctor and say, "Hey, do you practice according to the Hippocratic Oath? Oh, do you do abortion? Oh, well, the Hippocratic Oath forbids abortion." Bring that information back to your doctor and tell them about APLOG, because we are looking to be the resource that they need to be able to defend both the pregnant mom and her unborn child. So, we could use people coming to the website and looking and using the resources.
All right, thank you. And unfortunately, what happens, because abortion's such a polarizing, that's so polarized in our country that unfortunately sometimes we get lost in that, and they don't, like they'll say, when they say, "Oh, it's pro-life," so it automatically sways them. Oh, their research is going to say what they want it to say. And, I have a tendency to do the same thing, but, for us to really understand, we do need to come together and just take a look at the research. And, for me as a researcher, I'm just learning more and more about how to really read the research and, how we're asking certain questions. And, like what you just brought up, like what was the population of their, 5 or 5, that's really not a very accurate, that's not very many people. So it's just, it's really not just kind of taking that lens off and just looking at it rationally and reasonably, right?
Mm-hmm. Yeah, you're right. Kay, I think you kind of hit the nail on the head. Let's look at what the evidence really is. And at APLUG, we are committed to accurate science. Let's look at what the literature really says without a lens of we have to defend abortion rights. Let's look at it and see the harms to women. I mean, we just talked about medical abortion, but you know what? Women who have surgical abortion have an increased risk of preterm birth and subsequent pregnancies. They have an increased risk of suicide, drug abuse, hospitalizable major depression. And in a woman who aborts, especially as a younger woman, and then delays childbearing, she's got an increased risk of breast cancer. These are significant issues. And when you look at, there's a lot being talked about the disparity, the racial disparity in maternal deaths in women that die. So it's true. Black women die more frequently than white women who are pregnant.
Now, why would you, yeah, why is that?
Let's look at the rate. It's a threefold increase. You know what? Black women have a threefold increase in preterm birth. They have a threefold increase in breast cancer. And they also have a 3 times higher utilization of abortion than Caucasian women. So without looking at the fact that a woman's reproductive history affects her life and affects it in serious ways, the researchers completely will not touch the topic, the fact that there's 3 times as many abortions in Black women as there is in Caucasian women, and roughly 3 times higher risk of preterm birth, roughly 3 times higher risk of breast cancer, and roughly 3 times higher risk of maternal mortality. Well, why is that important? Well, what most people don't realize is that the term maternal mortality encompasses more than just women that die after birth. In fact, women that die after birth are only 60%, so a little more than half of maternal mortality. The rest of maternal mortality is death from ectopic pregnancy, death from molar pregnancy, and this whole silly category of, we don't know what happened to the baby. She was pregnant, she's dead, no baby. Well, come on, guys, this is 2020. You don't get pregnant, die, and you don't know what happened to the baby. I mean, the baby's somewhere, and it's not in her womb. So what happened? Okay, so it's this whole dumb on purpose thing that needs to go away. We need to look accurately at what all maternal outcomes are and the death rate after all maternal outcomes. But I'll tell you, we have fought this tooth and nail at the congressional level. And people don't want to know. They don't want to know what happens after an abortion. So they make the coding difficult to find. They don't track. They do track deaths after live birth, but not after abortion. And that has to change.
And excuse me, and so many stories that, women have told me, and we have several women that are sharing, their story, their experience with abortion. I think most often I hear either I tried to kill myself or I thought about killing myself. And like one gal, I remember reading her story is like, and I couldn't even do that good because the suicide didn't take. So that's just, it's just so sad that she feels that way. But you mentioned something earlier, we don't know the women that have committed suicide because of their abortion, because correct, they would code it as a suicide. But what was the backstory of that? What happened to cause that suicide to occur?
Well, that's a really good point. And again, there's a great study out of Finland. Why does Finland produce these good studies? Because they own people's medical record. But there's a great study out of Finland.
Oh, okay. So say that. So tell us about that. Finland has medical.
Finland, in the country of Finland, the state owns your medical record. So whatever medical care you have in Finland is recorded in documents which are accessible to the state. So there was a retrospective look at what kills women, reproductive age women in Finland, just kind of an innocent look. And what they found was that women who are pregnant and who either have the baby or have a miscarriage or have an abortion within that 1 year period of time, they look at the pregnancy and the ending of the pregnancy and what happens a year later. What they find is that there's a 4 times higher rate of suicide in women who have an abortion. And if you look and compare, instead of comparing to not pregnant, if you look and compare to women who have a baby, it's even higher. Because women who have a baby have actually a decreased risk of suicide. And women who have an abortion have an increased risk of suicide. And when I first heard that, I thought, really? But then what broke my heart is when you look at when the women commit suicide. They commit suicide immediately after the abortion or on the time when the baby would have been born. It's an anniversary reaction. And if this were a real psychological phenomenon, you would expect an anniversary reaction. And that's what they found. They found that women commit suicide around the time that the baby would have been born. It's terrible. And these women's deaths are not attributed to the abortion. They're just attributed to suicide without the backstory, like you said.
And I would one of my frustrations is that the research that people do, it's, even just a year, that's not enough, because I denied my abortion, but then 7 years later, when I was pregnant again, I saw the ultrasound, and that's when my trouble started. And then it was probably 5 years after that I just hit rock bottom. And I never was suicidal, but I wanted to die, if that makes sense, because I could not, you cannot deal with your crisis, your inner turmoil, your trauma for too long without having a breaking point. And that's what I did, because I didn't tell anybody, but I had a breaking point, and I pleaded to God, please let me die, because I'm going to hell anyway. This was my reasoning to God. I'm going to hell anyway, God, because it's the unforgivable sin that I thought at the time. So go ahead and do it anyway, because you might as well get it over with, because this is hell on earth. What more could, hell be? And Dr. Harrison, the sad thing about my emotional state was I was married to a man that loved me, and I had 3 precious kids at that time that called me mom. But yet internally, this was what was going on. And I just, I look back on my young self and just, want to just hug her and say, oh, honey, there is restoration, and there's healing, and there's God's grace.
Yeah, and that's the most important message that could go that you could give. I mean, I can talk about the scientific parts, I can talk about the medical implications, but what happens to a woman's heart, that's where I see women all around the country just breaking. And it breaks my heart to see the suffering, especially the psychological suffering and the betrayal by people who should have told them ahead of time, the betrayal by people that should have been there to help them. It's this kind of suffering that I see in women, and I just want women to understand abortion is not the answer. It's a tough situation. They're in tough situations, but abortion just complicates it. It makes a tough situation that much tougher.
Yeah, it doesn't wipe away it doesn't wipe away the problems, because the problems will still be there. So thank you so much for this interview. And, one last comment. You said something, so much time in our research, you become a number, in a quantitative study, you're just a number. But like a qualitative study, when we listen to stories, we add in the experience. And you mentioned something, it's the heart. So many times with these research, we don't hear the heart. And, that's why I think this moral injury, Dr. Harrison, will help us to understand the heart, because you said betrayal, again, the moral injury is when there's a betrayal of what's right, your moral compass, when there's a betrayal of what's right in a high stakes situation with someone I did it or someone in a legitimate authority. And, the consequences of moral injury, are great. There's trauma. Just all the things that we've been talking about, that's nestled into the moral injury piece because, combat veterans, they were committing suicide and they did research on why, because they wanted to help the combat veterans. And even Dr. Teresa Burke, we did an interview with her, and she said, like, the war veterans, she's helping the war veterans because of her knowledge with what she's done with Rachel's Vineyard, helping women recover. She's adapted. I'm going to research more about this after the interview, but she's adapted, and war veterans can see how our stories parallel, and that's what I'm researching. When I saw the moral injury, I'm like, that's it. That helps explain. We had Dr. Vincent Rue, who followed the PTSD, symptoms. And so, PAS, post-abortion syndrome, or post-abortion stress, he saw the parallel with that. Well, I'm seeing the parallel with the moral injury. So, and that's what the summit is all about, because, just interviewing people and getting their take on the moral injury piece. So what would you say, what would your opinion be on, the moral injury of abortion?
I think you are right on, because women are more than just bodies. And it drives me crazy that reproductive health is equated with abortion. Women are human beings with hearts and souls and minds. And we know somewhere deep inside that we were not created to be abused. We were created to be loved and cared for and to give our life-giving work to the next generation. We're life givers. We're the place where life happens. We're the place where the next generation happens, our bodies. And that should be respected and celebrated. And instead, we're told that reproductive health, it means you abort. There is something really screwed up about that. So I think you're right on to talk about the moral injury, because that's the sustaining, that's the sustaining and hurtful thing that happens for years and years in these women. I've had women tell me, I've been screwed up since then. There's no recovery for me. But there is recovery. There is hope. And there's always hope. And so to bring that message of hope and life and recovery to women, that's the water in the desert. So I think what you're doing is, like, it's tremendous.
Well, I know for me, I would have wanted something like this to go to understand, because I felt isolated. I didn't want anybody to know, and just to have people understand me, like when I read Vincent Rue's work, I'm like, that's me. And so I think this moral injury is just like, it's the capstone. It helps to encompass the heart and understand, all the dynamics, the biological, psychological, social, and spiritual aspects. So. Well, thank you, Dr. Harrison. I just really have learned a lot, and I know our viewers will as well. And I just thank you so much for your time and for blessing this Summit of Grace.
You're welcome. I'm glad to be here. And thank you for your work. Super important.
Oh, thank you. And more to come with the Summit of Grace. Thank you for joining us.